Like a black and white photograph cradling vibrant purple flowers, Black women with lupus carry vibrant strength and resilience within a condition that often casts shadows over their lives. Hello, and welcome to our special population video. I'm Joy Johnson.
I'm Amy 9.
And I'm Brenda Marquez Solano.
Before we begin our presentation, we want to open with a question that may help guide your thinking throughout this presentation. How do you determine if someone is sick, and what shapes your perception of being sick?
So, what is lupus? Lupus is a systemic chronic autoimmune disease that causes the body's immune system to attack itself. It affects the body's tissue and organs, including the heart, lungs, skin, kidneys, and brain. Symptoms include arthritis, fever, fatigue, the butterfly rash that's seen in the photo, hair loss, abdominal pain, and more severe cases, kidney damage, seizures, and heart problems. Christine Miserandino is an individual with lupus who developed the spoon theory in order to explain what it is like to live with lupus. So basically, an individual with lupus starts their day off with a limited amount of spoons, requiring careful allocation of energy to accomplish all the daily tasks. However, once they use up all of their spoons, they will not have the energy to continue, emphasizing the need for careful management.
Obtaining a diagnosis for lupus is a long process and involves a provider ruling out other conditions. They test the patient in many ways because a single test cannot confirm lupus. And so some of the tests include blood and urine tests, physical exams, the analysis of signs, symptoms, and medical history. These tests provide physicians with indicators of lupus. For example, a provider can test the protein level a patient has in their urine, and an increased level could indicate that their kidneys have been affected by lupus. Oftentimes, Black women are also misdiagnosed when they have lupus because the symptoms are so similar to other conditions, such as rheumatoid arthritis and chronic fatigue. Sometimes it can take up to 5 years for women to be diagnosed with lupus, which is a long time for someone to go without treatment or management. The diagnosis time is also longer for Black women due to the lack of awareness about lupus within their community and the dismissal of non-specific symptoms.
When talking about delays in diagnosis, many with lupus or chronic diseases overall feel as if they are on the clock, in that it's too late to start treatment or symptoms have gotten out of hand. In fact, a study found that increased time to determine diagnosis led to worse lupus outcomes in quality of life, disease-related damage, and disease activity. On average, from the first physician's visit to the diagnosis of lupus, it took 37 months to come to a conclusion. That's nearly 3 years that patients were left in the unknown.
The graph here demonstrates how Black people are disproportionately affected by lupus in the United States. From 2008 to 2011, the percentage of the population with lupus in Washington state was the highest for Black people. There are a lot of reasons as to why Black women are disproportionately affected, including their genetic association with the genes that play a role in lupus, higher level of hormones that are associated with lupus, and environmental factors such as stress that negatively affect lupus outcomes within the population.
There is research on how environmental triggers may worsen lupus symptoms. Of course, individuals who live in a healthy physical environment are more likely to see better outcomes in their health. While studies are currently unclear on the direct impact of these triggers on lupus, it is important to consider how things like cigarette smoke, contact with other illnesses, or even the medication one might take can impact lupus outcomes.
So some statistics regarding lupus incidence within the Black community. Generally, Black people have a higher cumulative mortality than their white counterparts do. In terms of incident and prevalent cases, the mean ages for Black people are 51.8 and 52.3 respectively, while 64.4 and 65 for white people. Black women with lupus are 3 times more likely to die than Black women in the general population. Looking at Georgia's lupus registry from 2002 to 2016, there were 1,335 lupus patients. Of them, 1,200 were female cases, and 77 of those cases were Black women.
This YouTube video is provided by the Lupus Foundation of America, an organization that works to improve the quality of life for people affected by lupus. Monique Gormassi shares her story of living with lupus and how this impacted her life. Pay attention to how chronic conditions can impact every sector of one's life and the unseen struggles one might face with lupus.
I feel so many different pains throughout the day sometimes. In order for me to get even moving, I have to kind of get up about 2, 3 hours prior to when I typically would have done so just to even get my joints moving. There have been times when I have gone to sleep with a head of hair and I've gotten up in the middle of the night and my hair has fallen out. I was undiagnosed for a year, and then when I was diagnosed with lupus, all these other things were put on the table as well. My joints have been swollen. I can't walk. I've been blinded. I was diagnosed with kidney failure. I was having cardiac issues. I've been in the hospital 2, 3 months. It affects your finances, it affects your body, it affects your friends, it affects your mental state, it affects so many different aspects of your livelihood. I was put on disability and it literally turned my life upside down. There's the stigma that does come out with lupus because we don't look like we have the disease, and I think that's also part of the problem. Reading about it and just hearing about someone that has lupus is completely different from knowing lupus itself. Lupus does not discriminate. It can affect anyone, men, women, white, black, older, younger. That is a part of the cruel mystery. And that is the mystery that we want to solve.
As discussed, Black women in the United States are more affected by lupus than other populations. As a result, the mortality of lupus in Black women is higher. On the graph, you can see that during 2002 to 2004 in Georgia, the cumulative mortality percentage was higher for Black people for each year after lupus diagnosis. This shows that greater research needs to be done because more and more Black women in the United States are being affected by lupus every year.
A history of trauma is linked to an increased risk of lupus incidence. This includes psychosocial and socioeconomic stressors such as poverty, food insecurity, racial discrimination, and lack of healthcare access, among others.
When addressing the social determinants of health, this figure illustrates the scale at which they affect lupus outcomes. At the bottom, we have healthcare access and quality, as well as demographics of patients. As the foundation, policies here are more specific to individuals as they aim to reduce economic burden and access to unbiased and consistent care. Moving up, we reach the community level, which focuses on communities and their overall access and quality to healthcare. Policies focus on locations to secure them with resources like healthcare facilities or education resources. Finally, the broadest level is focused on policies and interventions that promote societal change to reduce poverty, inequities, and discrimination.
To shine more light on this social determinant, living in a state of poverty or being unemployed has several connections with the incidence of lupus due to social stressors that these situations cause. Research has indicated that after being diagnosed with lupus, Black people are more likely to lose their jobs than white people, with the potential reason being their low work productivity due to their severe symptoms, which put them at risk of losing their job.
According to a study looking at a systemic lupus activity questionnaire and a lack transformed brief index lupus damage score, there is an association between the amount of racial discrimination experienced and the level of lupus activity. Generally, the greater the frequency in racial discrimination, the higher the likelihood of organ damage. Clearly, change is needed to address this health disparity, and there are several organizations that are investigating this problem, including the Lupus Foundation of America. Their Lupus AIM program mainly focuses on addressing the social determinants of health. There are other ways to reform, such as educational programs for Black communities about lupus. This would help spread awareness about the disease and help them access early treatment and management. Other reform options include policy aimed at improving healthcare access and community support programs for social support.
When looking at the next steps to take when addressing lupus outcomes in Black women, we also look at things like self efficacy. Self efficacy, in the case of chronic diseases like lupus, is one's own management of medications and treatments. In 2022 study by Drunkard et al., researchers looked into how self efficacy played into fatigue interference in Black women. They found that those with lower symptom self-efficacy had higher interference of fatigue and pain. For Black women, fostering self-efficacy through culturally relevant support programs and resources can be especially beneficial. Developing these skills can empower individuals to adhere to better treatment plans, communicate with healthcare providers, and cope with the physical and emotional toll of lupus.
As mentioned a bit earlier, it's crucial that more research is done on lupus and the repercussions on Black women in the United States. Not only must more research be done, but there must be a raise in awareness of lupus in this population to educate and support the Black women that are and will be affected by lupus. A complication of lupus is organ damage, and so it's really important that research is done to allow doctors to understand why Black women are disproportionately affected, why organ systems are affected in the way they are, and what can be done to prevent more people from developing lupus.
In terms of more recent research, the COVID-19 pandemic highlighted how vulnerable individuals with lupus, especially Black women, are to disruptions in healthcare. With higher rates of lupus and frequent barriers to care, Black women faced increased challenges, delayed medical visits, medication shortages, and limited access to telemedicine due to financial and technological obstacles. Combined with isolation and stress, this worsened symptoms and heightened anxiety and depression. This experience underscores the need for healthcare systems to prioritize accessible care, mental health support, and the reliable medication supplies, ensuring that vulnerable populations receive consistent care during crises. Our discussion for you today is: what actions can be taken to improve the support available to Black women with lupus, particularly given the additional stressors they face? Thank you.
Thank you.
Thank you.